can I too acknowledge the traditional owners on the lands on which we gather and pay my respects to elders past, present and emerging. Can I acknowledge some of my parliamentary colleagues? I think the member for Penrith, Karen McEwen, thank you very much for having us in your community. The Shadow Minister for Health, Kelly Sloan, the member for Vaucluse. Can I acknowledge the team from New South Wales Health, including our local health districts, chairs and CEOs, Nepean, Blue Mountains, Western Sydney and of course southwestern Sydney. Can I acknowledge the team from Health Infrastructure who helped build our infrastructure across New South Wales Health, and the Mayor of Penrith, Todd Carney. As a Dragons supporter, it always brings a shudder to be in Penrith territory. We can only hope and dream. We can only hope and dream. One other person that I know is here is someone whose family brought us a great deal of joy over the last few weeks as we watched an incredible nation do so well on the Olympic stage. And I want to acknowledge Richard Fox, the father of that very underachieving family, who have more medals than some countries do. We were so delighted to see the achievements of your two daughters, Naomi and Jess. It brought a tear to certainly my eye. I'm sure if everyone's honest, it probably brought a tear to a few people's eye here. And what incredible champions, role models and ambassadors, not just for this great city of Penrith, but our country. And I want to, on behalf of the New South Wales Government, acknowledge the extraordinary achievements of the Fox family. Thank you, Adam and the team from the Western Sydney Dialogue for having me here today. And what I will do today is take you through some of the challenges and be very, very upfront with you about some of the challenges that we are facing, some of the strategies that we're doing and building on from the previous government doing to address some of those challenges, but also hope to give you an insight into what keeps a health minister up at night. And there are one or two things. Now, I don't need to tell you, but this is a growing region. And with a growing region comes significant demand on our health services. And just over 15 months ago, I had the extraordinary opportunity to begin as your health minister, the state's 43rd, I think, from memory, and to take over from the incredible legacy and the work that the former Minister Hazzard did in this space. And I do, from the very outset, want to acknowledge Minister Hazzard, particularly for his work during the global pandemic. One of the challenges as a minister of a huge portfolio like this is to work out exactly what role you're going to play and how you're going to leave a legacy and how you're going to help shape and make a system even better. So for the first 3 or 4 weeks, my team and I spent an enormous amount of time engaging with health directly and frontline clinicians and the workforce, and started to shape what I've considered my 5 top priorities for this portfolio. Today I'll outline them and then pick one out considerable around emergency departments and have a look at what we're doing to try and address what has been a significant challenge and what is a growing challenge, particularly in Southwest and Western Sydney emergency departments. So the 5 key areas for me is about delivering essential health services the community needs and deserves. Importantly, building an engaged and capable workforce, providing world-class health infrastructure to communities, enhancing healthcare access and delivery in regional, rural and remote New South Wales, and of course using the health system to create healthier communities. I know we have Reverend Bill Cruz here today, and he is a man who has spent his entire lifetime working on how you use healthcare to deliver better opportunities and better outcomes from our most vulnerable people. And sometimes people laugh at me when I say I've spent a little bit of time going to see health facilities in our correctional centres. And people don't realise that New South Wales Health has a role in our correctional facilities. And I say very clearly to people that I'm the minister for everybody's health, not just those who can afford it and those who can access it and those with a high health literacy. And we know in communities in Western Sydney and southwestern Sydney, there is growing disadvantage, and that puts unmet and untold pressure on our health system. And a part of the remit of the Special Commission of Inquiry that is currently underway into health funding in New South Wales is to have a look at that issue, have a look at what that has led to, have a look at the challenges that we face coming out of a global pandemic. When I took over, and not through any fault of the former government or the former minister, the health system after 3 years of a global pandemic was under incredible pressure. We had significantly high staff turnover. We had close to 17,000 people waiting for elective surgery who had waited longer than clinically recommended. And we had and continue to have significant pressure on our emergency departments. What we did in relation to the workforce very early on is start to try and recalibrate and rechange the way in which we were delivering for that workforce. We removed the wages cap. We moved to a ratio-based system in our emergency departments. We started the work around trying to create a pipeline of healthcare workers, particularly around nurses and midwives, by providing them study subsidies to enable them to get through their degree and incentivise them to come and work in New South Wales Health. We needed and have increased the use of virtual services across the system. Minister Hazzard and I often joke together that one of the few things that was good coming out of COVID was the significant uptake in virtual care, something that would have taken politicians and public servants many, many years to do. But the pandemic forced a change in the way in which we deliver healthcare. And whilst we've still got a long way to go in this is a challenge that we need to face and need to build on. And of course, finally, making it easier for people to access regional healthcare by focusing on primary care. But the big issue is around ED demand. And whilst we have slowly got on top of the surgical wait list, bringing that down from 17,000 to under 2,000, our emergency departments are experiencing unprecedented growth and stress on their services. And I said today would be about talking about up front to you as experts in these fields, as clinicians, frontline healthcare workers, administrators, people in research and people working generally in the health space. We also have to be honest about the challenges we face. Over the last few months, as we move through the winter, there has been multiple days where our system has had close to 10,000 people accessing our emergency departments in a single day. That is significant demand. And when you have a look at the hospitals like Sonia has in Campbelltown and Liverpool, they are arguably the busiest emergency departments in the country right now. And pressure on emergency departments in places like Nepean, because of the growth and demand on those services, is something that we are grappling with right now. And it is not a criticism of the former government in any way. It is to be upfront and honest with you to say that the current model in the way in which we are delivering healthcare is extremely challenged and extremely stretched. And I'll talk about our relationship and what we're trying to achieve in the federal government through the federal government's partnership agreement in a moment. But it is challenging, and we have to be honest as a government right now. What we're also faced is significant pressures in our hospitals because of those living and with aged care challenges and NDIS needs. Right now in New South Wales, there are 2 hospitals the size of Prince of Wales, full of people who are waiting longer than what they should because of NDIS and aged care challenges and a lack of beds. That's a fact. That is a fact. And health works very, very simply. If you clog up one end of the pipeline, then trying to get through the front door is a challenge. So when you have that many people, 2 Prince of Wales hospitals, essentially waiting in acute care beds longer than what they're meant to be there for, and they're not moving because we can't get them access to aged care or NDIS support, that becomes a real challenge for those trying to manage acute beds, emergency department admissions, and get people through our busy hospitals. It's not a system that is sustainable, and I've made it very clear to the federal government that it is not a system that we can continue to operate with. The federal government may think this is a state health minister, always, as we always have, no matter our political colours, asking for more money. Of course we do that. That's what we're meant to do. But we've also got to face realities as a system. And when you have the responsibility of primary care and you have the responsibility of aged care or NDIS, that responsibility can't be shifted to our local health districts and their hospitals and their emergency departments. Now, in a 2-funded system, we need to work a way through that. And I'm confident, with the strong relationship that we have with Minister Butler and his team, that we will find a way through it. But to say we can ignore that component of the challenges we face is simply not right. And we, as political leaders and as legislators, must always remember that our responsibility is not just to the colour of the party that we represent, but it is to the people that we are delivering those services for. And whilst people may be shocked of the challenges that we face as a Labor government in New South Wales with a Labor government federally, I can assure you that we are going to be quite upfront with the community, with them, and with the broader health sector about these challenges, because they are real and they are having an impact right now as we sit here in some of the busiest emergency departments and hospitals in the country. So we need a better deal federally, and that is something that we are pursuing right now. What we also announced as a part of the budget was a significant investment in ED relief. What we've tried to do is open up as many alternative pathways for people to access an emergency department or not access an emergency department as we possibly can. When I was a child, and I'm sure many people in this room are the same, emergency departments were for emergencies. They were not for chronic care management. They were not GP medical centres. They were not places where people go to because they couldn't access any alternative primary care in the community. But unfortunately, what we are starting to see is because of that primary care challenge, because people can't access care often to manage chronic conditions, because of a lack of bulk billing in our community as we move through a cost of living challenge, then people are using our emergency departments and our hospitals for that quasi-care that would have been provided in the community. Now, that is not sustainable, and it is not fair on patients. It's not fair on their carers and their families who have to move into and have to travel into hospitals, but it's certainly not fair on our staff, both frontline, the administrative staff, and our CEs. And it's a big challenge. So what we set ourselves the task of doing is not just complain about the issues in Canberra, but to look at what we could do as a government to provide those alternative pathways. It's why we're investing over $100 million in urgent care services. Urgent care services fit between a GP and an emergency department. They are not a silver bullet. They are not a silver bullet. And yes, they are about the state investing in primary care, a responsibility that is traditionally the Commonwealth's. But we have no choice. We must build on the urgent care services that were started previously and we must continue to roll them out, because we need to provide communities, particularly in growing communities like West and Southwestern Sydney, with alternative pathways to seeing their emergency departments. We are investing in geriatric outreach services. One of the ways in which we're trying to keep aged care people out of the hospital so they don't get stuck into the hospital is by having geriatricians go into residential aged care homes, go into people's homes and deliver that care in situ. Because what we know when older people come into our hospitals, the increased likelihood of falls and hospital-acquired infections is greatly increased. And it is better care for them, wherever possible, for that to take place in a residential aged care home that they may be in or in their own private residence. The state is investing in that. We're investing in additional virtual care services. Virtual Kids is now up and running. We have got virtual care services right across the board. And importantly, what we are trying to do is get people familiar with Health Direct, that 1800 022 222 number, that people can access a registered nurse, a clinician, a mental health support worker, a mental health clinician, a specialist even, without having to go to an emergency department. And for those of us who have children, when they always get sick on a Sunday night, that's what happens in my family anyway, or they play sports like rugby league or mountain biking or crazy stuff like that, we've got to try and find alternative pathways to care for them and for those families. And investing in Healthcare Direct, that 1800 022 222 number, is something that we are doing. But we're doing more than that. Because when I came to office, I said to New South Wales Health, I don't think anyone knows that number exists. I said, I think if I walk down the main street of Wollongong, which is Crown Street, and I ask people, do you know what Health Direct is? No one would know. No one would know. And I looked about it in my own family. We hadn't used it previously. Yet here was this service designed to try and keep people out of emergency departments. So over the last few months, I've been talking with my federal counterpart and with my state and territory representatives, and I want to get that number down to 3 digits. Because when you scan health systems across the globe, many of them, many comparable health systems have a 000 equivalent, but then they have a triple-digit number for urgent but not emergency care that people also know. And it's funny in this country, we teach our 2- and 3-year-olds that if their mum or dad are collapsed, or if they see an accident, this is a number you call. And many of us who have children could tell you that probably by the age of 3, they'll know what number to call. And that's fantastic. The problem is with the health system at the moment, not enough people know about this other one that keeps people out of hospital and provides an opportunity for people to access care without accessing the hospital or the emergency department. And that is something that we are determined to continue to lean into. We're also investing additional funding into our expanded short stay units. Those of you who don't know, they're units off to the side often of an emergency department that enables people to stay between 4 and 24 hours, but it improves the flow of patients through the ED and through the broader hospital. What we're also doing is investing in discharge and patient flow concierge services. These are the people who essentially will be doing the administrative work to get you, your family or your loved one out of hospital faster. We know there is considerable administrative work that goes into discharge of a patient. When that's done by clinicians or nurses or allied healthcare workers, we're taking them off the floor and it's reducing the time or increasing the time in which people are staying within hospitals. In fact, if you go to some hospitals, people have been sitting there for hours. They're not getting access to acute care, they're just waiting to be discharged. Now we need to do better. And that's why today I can announce that 18 of these new roles will be deployed across southwest and Western Sydney and deal with some of the biggest challenges in moving patients through our emergency departments and our hospitals. Can I also say that one of our focuses is around making sure that we are delivering the critical infrastructure that Western Sydney's growing and southwestern Sydney's growing communities need and deserve. Big investments in Liverpool and Nepean, significant rebuilds around Fairfield and Canterbury, a massive and challenging build at Bankstown. These are significant, and they build on what the previous government did in places like Campbelltown, and also funding for a hospital in the Western City Parklands or Aerotropolis area, which we will know we will need going forward. These are significant investments. In fact, they total over $3 billion going forward. But they're investments the government can't afford not to do. With growing communities, particularly in southwest and Western Sydney, we know that the growth in infrastructure is absolutely critical, and we are determined to work with the team at the local health districts, work with the team at health infrastructure, but work with our partners in the private sector to make sure that we deliver those hospitals as quickly and as effectively as we can. We've recently brought in changes through the Cabinet process of trying to streamline and fast-track the way in which hospitals and schools can get delivered so they don't get stuck in planning processes. This is a challenge for us at the moment. This is a real challenge. And if we're talking about challenges, moving hospitals through that system is a challenge. But working with the Planning Minister, we've now got a team and a focus where those critical infrastructure, predominantly schools and hospitals in growing communities, can be delivered in as quick a time as we possibly can. Now, that's something that we're going to have to work on, and a challenge we're going to have to work on with no doubt the private sector, but also our colleagues across government. And we're also faced a challenge about the growing cost of infrastructure. In fact, we had to invest and find an additional $200 million in this year's budget, simply to take on the growth of the cost of hospitals that has occurred because of the increase in labour costs, because of the increase in supply chain costs and the increase of products and building materials across the board. That is also a challenge, a real one that we face in a constrained fiscal environment. And we're also investing in technology, and that is something that I'm very, very proud to see we are doing. And I know that from the list here today, many of you are from the health technology workforce, the AI sector, those in ICT, and we have to, well beyond what we're doing in virtual healthcare, we have to embrace technology, not be afraid of it, and see how we can use it to take pressure off our emergency departments and our hospitals, but also, importantly for me, deliver the healthcare that people need and deserve. I believe that AI has the potential to have a significant impact on the way in which we manage healthcare, presenting great opportunities for clinicians and patients. And in healthcare, we are, as a system, and we always should be, as a system, conservative in relation to the way in which we deliver our healthcare. It's ensured that we have one of, if not the greatest health system in the globe. However, we can't be scared of technology, and we can't be scared of what AI can bring to the table. We have to be cautious, but welcome it. We have to be challenged, but careful. And this is an opportunity to do exactly that as we face some of the wicked problems that I've outlined today. Already, there are AI initiatives in place across New South Wales Health, including delivering better wound care, simplifying complex data analysis, saving time by automating repetitive processes and reviewing large volumes of cardiology literature to aid in clinical decision-making, making it faster for clinicians to make accurate and reliable diagnosis on their patients. But this year's budget committed something that I'm very, very excited about. Not necessarily a huge amount of money, but one that I think has the opportunity to take some real pressure off our EDs in our hospitals. $15 million has been committed towards a critical upgrade of the New South Wales Ambulance Matrix system, known to some of you as New Gen Matrix. New Gen Matrix will consider a number of factors, including a patient's clinical condition and acuity, real-time ED activity, as well as relevant patient history and clinically appropriate alternatives to the ED. So in real time, it means this. One of our world-leading paramedics can pick a patient up and at their fingertips, inside their ambulance vehicle, they can get a real-time view of what is happening in our emergency departments. So they make a decision to go to Campbelltown, not Liverpool, Fairfield, not somewhere else. This is real-time data for them to have a look at right then and there. They can then put in the acuity of their patient and then make a determination where and when they should go. The moment that's not in place, it's static, it's not real time. What we're using the technology to do is try and make it easier for those paramedics to make the best decisions for their patients, but also the best decision for how the system can help care for their patients. I'm very pleased today that we can announce that this nation-leading initiative will see its first test next month. It's part of the rigorous and comprehensive testing we are doing to ensure we get the system right and ready for rollout across the state by the back end of next year. Ladies and gentlemen, we are determined to work with you, whether you're in the public sector, the private sector, the not-for-profit sector, to make delivering healthcare in New South Wales as effective and as strong as it can be. But together, we've also got to be honest and upfront with each other about the challenges we face. And wicked problems lead to fantastic solutions. So I say to all of you, we don't pretend to have every answer to the wicked problem. But in this room, there are potential answers to some of those problems. So we say to all of you, stay engaged. Give us some of your solutions. Think outside the square. Because at the moment, we need all of those things. Given the pressure our emergency departments and our hospital staff are facing, they have a right to expect industry leaders, to expect legislators, to expect policymakers to be continually looking at ways in which we can deliver healthcare better for them and, most importantly, better for patients. Thank you for your support of this great event. Thank you very much for having me here, and thank you for contributing to the healthcare of those living in South West and Western Sydney.
Thank you, Minister. We sat here, probably not in this room, but about 12 months ago for our last forum, where the focus was very much around people services. You mentioned things around ED waiting times, reining in spending, improving the customer experience. 12 months on, how do you think you're going?
Yep, I'm probably my toughest critic. As my parents will say to me, I'm incredibly impatient. So some of the CEs here know this. We're doing well in relation to retention. We're doing well in relation to the rollout of additional staffing. I would always like it to be faster. I think the challenge going forward in relation to staffing, to be quite frank, is coming out of a 3-year pandemic. How do we make sure that healthcare is still a profession that people want to both get into and stay into? And that is a wicked problem that we all face. It faced Minister Hazzard, particularly during the pandemic, as people at the back end felt very, very tired, and rightly so. And it faces us now. So what we're trying to do is have a look at that pipeline of both workforce coming in, how do I support them as they're doing their training, and then how do I try and make the profession as robust and as strong as possible, so when they come in, they feel supported. Now, our CEs and senior staff are doing fantastic work to help mentor some of our nurses and our doctors and our allied healthcare workers, because when I go around our hospitals, particularly when I do my unannounced visits, what always strikes me is that we have a huge number of very, very junior staff in the system. Now, that's fantastic in one element, but it brings challenges in another. And I think where we've got to get better is how do we make sure that we are providing the support to those early starters to make sure that they feel supported, make sure they feel a part of a team, make sure they feel safe to deliver their professional responsibility. That's one component. But then also we have to think about how do we keep people who have been in a system for a while and have also just come out of a 3-year global pandemic. We don't pretend to have all of the solutions yet. We do think removing the wage cap helped just to start to bring back some parity with wages across the nation. But without a doubt, we are going to have to continue to look at ways. And one of the reasons why we're focused on rolling out the ratio-based system in nursing is that, yes, research demonstrates that obviously more healthcare workers in an area delivers better patient care. That's pretty easy to understand. But it also, if you dive into the research, shows that it helps with retention of staff because they feel more supported. And that's particularly important in emergency departments where they're seeing unprecedented demand at the moment.
We're in Penrith today, once declared the hottest place on the planet a couple of years ago. Heat is a big issue. We've released a paper today talking about the impacts on health in Western Sydney, which is more exposed to these sort of issues than other parts of the city. I suppose in the context of a development agenda led by housing at the forefront, we're seeing more decisions being made around land use, transport, infrastructure. How involved is health in terms of having a seat at the table as part of those conversations?
Yeah, significantly, because I make sure as a minister that we are to be quite blunt, because let me tell you why. Health infrastructure, unlike a lot of infrastructure, is enormously labour intensive. It operates 24/7. That is unique in terms of other infrastructure. If you compare it to, say, roads, it doesn't have that labour input. People move across them, but there's not that labour-intense activity. Health is, and what I keep on saying to the team at New South Wales Health, and really, really proud of some of the sustainability measures that they've put in place, is that not only do we have a responsibility to build something that delivers good clinical care, but we also have a responsibility as a citizen, as a global citizen, as a corporate citizen within a particular community, that we deliver infrastructure that is as sustainable as possible. And the demands on health in terms of electricity and water use is absolutely enormous. But it also has an enormous amount of concrete, given the nature of it, and an enormous amount of footprint. And what we've been looking at, particularly in local health districts like Hunter, New England, who are doing this very strong, is what are the things that we can do both in terms of new builds, whether that's solar, whether that's obviously recycled water, etc., but also what can we do in a sustainable way by retrofitting areas to make our existing hospitals as sustainable as possible. Health has one of, if not the biggest drain in terms of carbon emissions, in terms of a portfolio than anywhere else. And as the Minister, I've got to be leading a conversation within my own portfolio to say what we are doing, because the community is very clear that they expect decision makers and policy makers to have this as part of what they deliver, not just delivering healthcare, but delivering healthcare through a sustainable facility, and that's going to be an ongoing challenge.
You mentioned the new builds. Obviously, there's a few big ones coming up, Bankstown, Rouse Hill, and we'll hear a little bit more about them today. Do you see a role, given the focus and intent by the Minns government around housing, that there may be some opportunities to build into those projects housing? The nurses' quarters at Westmead is sort of an example of how it's been applied in the past. Do you see some opportunities around that to maybe incorporate some frontline housing for workers?
Yeah, I do. Absolutely, I do. And I have a look at this in my own community, down in Wollongong. We've got a traditional hospital model where it's all hospital and not much else, and doctor facilities around it. Yet we have people travel very large distances, often from southwestern Sydney, and reverse. Us come up to here in Western Sydney to service these hospitals. And when you look at hospitals, they can't no longer just be a medical facility. And I say that because of their 24/7 nature and their size and scale, they must take into consideration those housing needs of the people that will work within them. Now, across New South Wales, we're investing an additional $200 million into key worker housing. That in initial phases is predominantly in parts of regional and rural New South Wales, and that's important because we can't get the workforce to those areas if we don't have housing that's of a suitable standard. People just won't come. It doesn't matter the incentives you've got, it doesn't matter. So that's a part in which we're playing to actually attract and sustain workers. And what we will also start to look at through both the Minister for Housing and the Minister for Planning is how we can grow that key worker housing across metropolitan and large regional centres, because sometimes people think it's just nurses and doctors and allied healthcare professionals who run hospitals. It's not. Hospitals don't open without one person, and that person's a cleaner. And that person does not earn huge money, and that person often at the moment is forced to travel long distances to access the labour market and the workforce. So that is a real challenge for us. The Premier's made it clear that housing is a top priority of the government's. That obviously means that we will be playing a role to deliver that key worker housing, particularly in our regard, key health worker housing.
One final one, because we are out of time. You mentioned the importance of that integration with primary care, and I know you've been having conversations with your federal counterpart, Minister Butler. Can you talk through some of the key headline messages in those conversations, knowing that there's still a lot of, I think, work to be done to bridge that gap, particularly when it comes to funding?
Yeah, I can. And it is a challenge, and it's a challenge for him and the federal government, and it's a challenge for me and the New South Wales government. Where we're at is trying to make sure that when the state leans into what is traditionally the responsibility of the Commonwealth. So I talked about urgent care services in my address. Largely, obviously, that's primary care. When we do that, where and how can we be expected to be funded for that? And at the moment, what we're doing is investing into them, but we're not recouping that money back. And rightly so, people would have a right to say, well, hang on, you're responsible for that, they're responsible for that, stick to your knitting. But the challenge for me is, and it was a challenge Minister Hazzard faced as well, having had many, many discussions with him, is if we don't invest in the parts that are not traditionally our responsibility, it leads to huge problems to our hospitals that do have a large that we do have responsibility for. And what I've tried to say to Minister Butler and the Commonwealth Government is they need to look at this not as a two-tier funded system, but as one system, and what each of us are responsible about, making sure that we're delivering that to the best of our ability. I'm not asking Minister Butler to run our hospitals. I'm not asking him to run our emergency departments. I'm not asking him to employ our nurses. But equally, if we don't have a primary healthcare system that's working well, if we don't have the availability of aged care beds in communities, if we don't have significant NDIS support, then we are left with a situation where we are now, where we have an enormous number, the size of 2 Prince of Wales hospitals, people essentially trapped in hospitals across New South Wales. And that's not fair on our frontline emergency staff. Now, we're not over the line yet. Sometimes I think we're close and other times I think we're not. This will be an ongoing dialogue over the days and weeks ahead. We're having another dialogue tomorrow about this. This is a challenge that we face, and it's a challenge that all of us are going to have to work through. We each have our responsibilities. I understand the Commonwealth Government has challenges. I know he understands we have challenges. But the reality is we have to find a pathway, because the only way we can as a state continue to deliver healthcare that's sustainable and effective, particularly for growing communities in areas like where we are here today, is that everyone has to go as strong as they can on the areas of responsibility that they have charter for. And we've got to get as good as we can on the areas that we take responsibility for. Yeah.
Well, Minister, thank you for taking up the fight on behalf of the state and the region. Thank you for the support of this event, and thanks for coming up today, mate. Appreciate it.
Thanks a lot.
I'd now like to call upon the Honourable Peter Collins, the Chair of Nepean Blue Mountains, to give a vote of thanks to the Minister.
I'd like to begin by acknowledging the traditional owners, the Darug people. I also want to acknowledge Member for Penrith, Karen McEwen, Member for Vaucluse, Kelly Sloan, and Mayor of Penrith, Todd Carney. And thank you all for being here today. I'm, as Chair of Nepean Blue Mountains LHD, very much the host today, and it's great to have you in this brand new facility, about a year old now, but part of the Panthers precinct. I want to acknowledge what the Minister's just said. Minister, in a previous life, I faced the same sort of challenges. You're the foundation minister for the Minns government. You're the one who will set the direction that your successors in this ministry will follow. You're in a very special position, and I think what you've shown us today is a real grasp that you have and a passion that you've got for this portfolio. You asked for this portfolio. You had it for a couple of years before the change of government, and I think it's evident that you've got a deep interest and a deep knowledge of it already. What today is about is us working with you and building that relationship, building the platform. You've taken us through the challenge faced by our emergency departments, which have become a first port of call instead of, I won't say a last resort, but as you put it so succinctly, where you take the real emergency problems to, the way it was in the past. So we need to get that back in balance, and that's something that we need to work through with you. And obviously you've given it deep thought. And I know that you've met with our emergency department in Nepean and I think the other EDs in the other Western LHDs. So I couldn't resist the opportunity today to not make reference to the historical imbalance that we face in the West. So when the three Western Sydney LHDs banded together with the Western Sydney Leadership Dialogue to do these events on an annual basis, it was about trying to overcome the 150-year advantage that the East and the North have in Sydney. We're on the fringe. This is where the population growth is. This is where the infrastructure is being built. And this is where we don't have some of those historic advantages like philanthropy and like bequests over the last 150 years from grateful people, patients, families who've been treated so well by our public hospital system over that time. So we're trying to make up time. We don't have hollow logs. We don't have as many hollow logs. I mean, ministers are always looking for hollow logs, but we don't have as many as in some of the older, better resourced areas. And so we need to, I think in addressing funding issues, take a look at that. The fact that you come from Wollongong, you face, exactly the sorts of issues that we face on the fringe. The Hunter, the Illawarra, Western Sydney, we face similar sorts of problems, and so we need to face them together. Thank you very much for the time you've given us today and the from the heart observations that you've made, and I'd ask all of you to show your appreciation to the Minister. Thank you.